All right, guys, if you are a woman yourself, you need to listen to this one. And if you are a man, you no doubt have women in your life, you need to listen to this one as well. Xoli Madlala is the founder of Redefining Menopause Africa. She is a globally recognized menopause thought leader, transforming how Africa and the world understand, experience, and respond to menopause. An internationally certified menopause coach, policy advisor, and author of The Perimenopausal Globetrotter, she brings a powerful blend of expertise and lived experience, driving conversations that are inclusive, accessible, and transformative. She has a very cool and very simple philosophy, and I'm going to let her explain it to you. Xoli, welcome.
Good afternoon, everyone. Two disclaimers before I go any further. If you see me suddenly glistening, I'm just going to be having personal summers, right? It's not because I'm nervous or anything. And if you see me almost looking like a deer that is caught in the headlights, like there's a disconnect between the brain and the mouth, it is because my mind is buffering. Those that get it, they totally understand what I'm talking about. By the show of hands, who was here last year for the conversation on amplifying voices of menopause? So today is a continuation of that. Whenever we speak menopause, what is the first thing that comes to your mind? Older? Getting fat? Yes, ma'am? Hot flashes? Any other takers? Yeah, ma'am, don't restrict yourself. We're all here to engage. What's the first thing that comes to your mind? Oh. Drying up? Okay. You again, ma'am? No menstrual periods, which can be a positive, right? If you no longer want to conceive and all of those things. Because we hardly speak about the positives, actually, that come with menopause. Anyway, before I go any further, because this year we're taking things a step to the next level, I'm going to share a bit of stories from women. I'm going to start with the women from the UK, because I always say relatability is important. We can have the book smarts, but nothing connects more than hearing what people truly experience. So the first story, I used to be a prison officer in a huge men's prison in London. I was on the riot squad and also in the gym every day. I was super fit, strong, and very active. In 2015, when I was 34, I ended up having to leave the job because I was falling asleep at work, putting on huge amounts of weight for no reason, and losing strength, and suddenly my muscles and joints were in pain and I could not do the job anymore. For the next 7 years, I begged my GPs to tell me what was wrong with me. But time and time again, they told me that nothing was wrong with me, that I just needed to lose weight. I had gone from size 10 to an 18, and not because I was not active. I lost jobs, had terrible fights in relationships, spent years being called lazy. After 5 years of this, I went back to my GP in tears, armed with a list of symptoms. There seemed to be 100 symptoms, by the way. And she told me I probably had a winter cold and to stop coming in because I was wasting her time. I haven't been to a GP ever since. These stories are on menopausemondays.com if you want to read more of them. And then another one, having suffered with hormonal migraines all of my adult life, my migraines became unbearable. I started to suffer with anxiety and panic attacks. Then I started with stiff joints, which appeared without warning, and I was angry and inflamed. I constantly contacted my GP for help, and each symptom was treated individually, being told I was too young to be going through perimenopause. No GP seemed to want to investigate that avenue due to my age, 41 at the time. Instead, I was offered antidepressants, but I knew that there wasn't depression. I am now almost 43, have finally found a doctor in my surgery who took time to listen to me. This is just some of the stories. And then you come back to South Africa. There are so many stories that are not documented. Having been doing the work that I do in the space since 2016, some women don't even have the vocabulary to use when they go for their consultation. And I always make sure that we do not leave anybody behind. So some people might say that, okay, we hear the term menopause, but they don't fully understand what menopause is. And in a non-jargon way, we're just going to lay the foundation so that we don't leave anybody behind. Otherwise, what is the point of this conversation when people are just going to be excluded? And that's another reason that women always say that I feel like the conversations that I have with my doctor don't involve me because there's so much medical jargon that gets used. So it is one of the pointers and the guides that doctors can actually be intentional when they are speaking to their patients during consultations to make sure that the patients truly and fully understand what they are consulting them with. So I always say that in the quickest way, menopause is the opposite of puberty. We know that with puberty, a girl starts her periods. If she has sex, then she will obviously fall pregnant. Menopause is meaning that a woman's ability to fall pregnant naturally it comes to an end, and she will no longer also be able to conceive naturally. And natural ages of menopause is from 45 to 55, 51 being the most common age. But yet again, these are just guidelines. We see women, for example, the other time I bumped into a lady, she's 64, rocking high heels, energetic and everything. And she's 67 and she's still getting her periods. And everybody was shocked. It's like, how come? And then she explained that she only started getting her periods when she was 27, meaning that her everything is happening more delayed. So if she was to look and read medical books, she could feel that something is wrong with her. But while in the truest sense, nothing is wrong with her. Her journey, her body is relevant to her, and it is valid. While we also have cases like Annabelle, who went into premature at the ages of 13 going on 14 when her periods just stopped. And then again, we wonder how many Annabelles do we have here in South Africa, here in Africa, because the subject still hardly gets spoken about or get the airtime that it needs. I'm sure most of you also, as medical practitioners, you can agree that, menopause is still very under-researched, very understudied. And that is why we get cases like this when some women say that I feel so unheard. I feel like everything that I am speaking about, because it does not fit what the medical books say, then it is invalid. 58% of medical books actually do not have anything that speaks on menopause, which is a scary reality. And then 11% have less than a chapter that speaks to menopause. And it's 2026 now. We really need to be intentional about making sure that half of the population will feel that they are catered for. As it says, in 2030, 1 billion of women will be in menopause. And women sometimes go into menopause way before time. I mentioned premature menopause. That is when menopause happens before the ages of 40. Whether it's in the 20s, it's in the 30s. I went into premature menopause in my early 30s. I also wasted so many years looking at the symptoms in isolation because growing up, nobody was talking about menopause happening way before time. So for a good 8 years, I was looking at lactose intolerance when I was struggling with digestive issues. When I was struggling with brain fog, I will wonder whether I'm losing my mind, what is going on. When I was getting things like your hot flashes and night sweats, my mom looked at me and her first question, as a typical black mom, meaning when was the last time you detoxed or cleansed your system? She was ready to get castor oil for me or something because she could not believe that her daughter was going into menopause before her, which again goes back to the reality that menopause is different, it's not one size fits all, and all experiences should be given the dignity that they deserve. And then when it happens, obviously, between the ages of 40 to 44, it is early menopause, like the story that I spoke about, the lady that was 41. Another bias that happens is when you get looked at and then you are told that you don't look like the face of menopause. And that's so many women's stories that they say they go for consultations, they explain their experiences, and the doctor says, no, there's no way that it is menopause. maybe let's look at you getting on a certain diet if they're struggling with maybe weight gain issues. How are you sleeping? But they are not heard properly. They don't even ask for their history, like the past 6 months, what has been happening in your life? The past year, what have you been experiencing? Especially during the transition to menopause, because we know that with perimenopause, women are still able to conceive, even though their periods are irregular, but they are able to conceive. I've had a lady say to me, you know, my gynae has been so wonderful to walk the journey with while I was pregnant having children. But now that I can feel that perimenopause is here, every time that I bring it up, he changes the subject. I'm going to have to find another gynae. And you wonder whether it is because maybe he looks at her and then believes that she doesn't look like the face of menopause. Or, as we say, that menopause is under-researched and understudied. So some of the medical practitioners are not as comfortable to go that route. Same as some when women want to discuss medical options, some doctors do not even want to open the door. And then another symptom or another phase that we hardly speak about also, that is when women go into medically induced menopause. Most women say that they are not prepared for when they do, whether it's the full hysterectomy, having their ovaries taken out, that they are not prepared for the full-on medically, surgically induced menopause that is waiting for them on the other side, which is very important because language, again, when the women are about to go for those sessions, there's a young lady in her 20s from KZN who was pregnant. When she went into labor, they had to do a C-section on her. Then she was cut by mistake on her uterus, and she was bleeding. And then she was told that they're going to have to remove now her womb, or else she's going to bleed to death. And she says that being under, obviously, her biggest thing was like, I just have given birth, I've got a new baby, so let them do whatever that they need to do so that I can just be alive for my baby. She just signed the form. And then, obviously, she went into surgically induced menopause. And then she says that she was not prepared for any of the things that she had to put up with. She says that, the night sweats, staying in a vulnerable place where in her, what is umkuku in English? A shack, yes. She will say that staying in a shack, when it's hot already. Then you add now the night sweats and everything. She will have to step outside to sit so that she could cool down. And then when she went for a consultation, she was just prescribed antibiotics. And then it's like menopause, antibiotics. And obviously the symptoms kept getting worse. And every time she will go back there, she will be given more antibiotics. And antibiotics are not meant to be a way of life, right? They're just meant for that period, and then life continues. And then eventually, obviously, her ability to have more children is out of the window. She says the consent form was in English, because that's another thing. So many people get excluded. They just get told, sign here. But most of them, they do not know what they're signing for. So that's another thing that needs to be looked at. It's one of the blind spots that happen to women and just patients, I guess, in general. But it is important that consent forms, I do not know, obviously, maybe someone can think about it, whether there is a way to have consent forms that accommodates all the languages that we have, whether then they might be printed on demand or how. But it's something that we hardly speak about, the exclusion that is due to the language, that people just end up signing their lives away, not being aware. So then at some point, they decided to have a class action, because then she found other women that had gone through also some medical negligent cases. And then she was told that she was going to be compensated with 50,000 rands. And she was like, but in the bigger scheme of things, because we know that the care that comes with this phase of life also is quite costly. Hence, it excludes so many who I call invisible women. We know that whenever prescriptions are made, it excludes so many of these women. Hence, then the Tshwane study, where some women think that it's better than to ingest some of the herbs inside their vaginas so that they can try and treat their menopause symptoms. Because firstly, whenever we speak menopause, it's in heavy jargon. so women are excluded. We think that this conversation or the subject is for a certain education group, for a certain income group. So these women, because nobody is speaking to them or educating them, even when they go to the clinic and everything is rushed, then they think that they've been bewitched, especially when they're getting like the menopause belly, and then the blood is not coming out, the periods are irregular, then they think that I need to ingest this blood to come out, not understanding that they are actually going into perimenopause. And then another thing also that is important while we are having these consultations that becomes a blind spot is also the postmenopausal women. There is Mam Gugu also from Durban. She is in her late 60s, going to 70, single. Then she started struggling with an itchy vagina. For a while, she was trying to get over-the-counter prescriptions. Eventually, she started going for consultations. And the doctors will prescribe this and that, this and that. And at some point, one doctor asked her how many boyfriends does she have. And she was offended, firstly, to say that, at my age, why would I be promiscuous? Because that's what the doctor was implying. So then it goes back now to say that manner of approach is important, even if there is a need to find out the sexual history of a patient. It is important to be able to ask in a way that their dignity is still intact. And also, before I go further, I would like us to go through actually the list of menopause symptoms. We've mentioned the hot flashes. We've mentioned the weight gain. Any other takers? Brain fog? Sandpaper skin, yes. Night sweats. Hair falling. Anybody wants to take one for the men? Like I've been hearing so many women's voices. Okay. Huh? Vaginal dryness. Thank you, sir. I felt like you had to dig deep to it. You're like, yes, vaginal dryness. Yes, Ma'am Sylvia. Oh, I cannot hear you. Mood swings. Okay. All right, I'm just going to quickly run through the list, if you allow me, because you might just glean something that you might not have been aware of, and maybe you might have aha moments for someone at home that you coexist with, your mom, whoever. So, yes, it's the hot flashes, the night sweats, irregular periods, heavy or light periods, spotting between periods, vaginal dryness, vaginal itching, vaginal burning, painful intercourse, decreased libido, breast tenderness, breast shrinking, weight gain, especially around the abdomen, bloating, fatigue, joint pain, muscle aches, back pain, neck pain, headaches, migraines, dizziness, tingling extremities, whether on the hands, feet, or face, electric shock sensations, heart palpitations, increased heart rate, changes in body odor, increased perspiration, cold flashes, itchy skin, dry skin, oily skin, acne or breakouts, skin crawling sensation, thinning hair, hair loss, dry eyes, blurry vision, eye twitching, tinnitus, which is the ringing in the ears, gum problems, dry mouth, burning tongue, bitter or metallic taste in the mouth, frequent urination, urinary incontinence, painful urination, UTIs, digestive issues, constipation, diarrhea, nausea, food sensitivities, allergies, new or worsening, cold intolerance, heat intolerance, low immunity, breast lumps, usually benign but require checks, osteoporosis, brittle nails, nail ridges, restless legs, leg cramps, heel pain, loss of muscle mass, loss of skin elasticity, dark circles under eyes, puffy eyes, premature aging signs, mood swings, irritability, depression, anxiety, panic attacks, crying spells, memory lapses, difficulty concentrating, confusion, loss of motivation, low self-esteem, feeling overwhelmed, emotional sensitivity, lack of interest unusual activities, social withdrawals, racing thoughts, increased fears or phobias, insomnia, difficulty staying asleep, vivid dreams or nightmare, fatigue despite sleep, loss of joy or pleasure, suicidal thoughts. In severe cases, professional help is essential. Then, yes, we spoke also loss of sexual desire, pain during orgasm, inability to orgasm, genital numbness, vaginal laxity, shortened or disappearing periods, bleeding after sex, cervical changes, feeling invisible, loss of purpose, change in voice tone, increased facial hair, changes in body shape, body aches that mimic flu, slower metabolism, disrupted circadian rhythm, sensitivity to noise, clumsiness, feeling detached from reality, loss of identity, decreased creativity or inspiration, slower reaction times, changes in handwriting, sensations of pressure in the head, height loss, chronic inflammation, swollen fingers, changes in posture. These are just some. It is a Bible, right? And then we can take offering, right? It is shocking because normally we always hear the same old symptoms. Hence, then when women are not presenting the expected symptoms, then they are not thinking that they are either perimenopausal or in the deepest and the thick of menopause itself. So the more we know, because I think most of us, we are having flashbacks. I always say, the moment I found out about these things in 2016, thinking back as a child when you'll be playing and then you're making noise and suddenly you are shouted like, keep it down, keep it down. And then it's like, okay, noise sensitivity was a thing, but we could not understand. When your mom would be calling you, Xoli, then you come and then they're like, no, not you, the other one. And you're like, but then why didn't you call the other one? Because you gave them that name. Why would you forget their name? But now it makes sense that you forget the simplest of things, you know? And as we say, the social battery and all of those things, you find that even your patient, that you knew that they were easy going, even consultations, they used to be able to advocate and speak for themselves. Suddenly they're just sitting detached from reality and all of those things. They do not know what's happening. But then if medical practitioners know as much as possible, then they can make all of these connections to say that this person is actually changing. She might not be presenting with the hot flashes. She might not be having all of these expected things, but these are the things to have. And also one of the biggest wishes is also having a central space where when a woman has gone to maybe see an optometrist because they're struggling with blurry vision, dry eyes, and all of that, then whatever that is captured, there all the other doctors that they consult with, the different specialists, can have access to that. They have gone to consult because they're feeling like their breasts were tender and all of that. Then some, they think that, oh my God, am I having breast cancer? And then they have gone to do mammograms. So if there's access to all this, then the medical practitioners can be able to connect the dots to say that she's been consulting separately for this, she's been consulting separately for this. Possibly, actually, perimenopause is knocking because, as we know, even simple things like your hot flashes, they start as warmth and that it disappears. But as you get deeper into it, obviously things do then get worse. And that's when then we start sitting up to say that, oh, hot flashes were here. But then the more women have normalized consultations where they also get educated, especially from the ages of 30, then as a GP, you start finding out, do you want to have children? What is your plan? Because these days, women are putting off also having children for a number of reasons. Whether they're still chasing their careers, they're building businesses, maybe they're waiting for that ideal partner. So they are not thinking about what is happening internally. Nobody's talking about the options of whether freezing eggs, or even sometimes when it happens. Last week I was talking with another lady, she's 36. And she was speaking with the doctor to say that I think I should consider freezing my eggs. And the doctor was like, no, you're healthy. There's no need to do that. And that was that. Chapter is closed. No other, like, why are you insistent on that? Because if anything was to happen, say maybe at 40, and she decides that she wants to have children, and she's struggling, then the doctor is not the one that will be held accountable because ultimately it has her decision. But because she is trusting the doctor so much, then she might actually be jeopardizing her future prospects of being able to conceive naturally. And then another thing that gets also forgotten whenever we speak this menopause transition is the iron and the vitamin D, the role that it plays into how women present. Because some of these symptoms, they do mimic also low iron, low ferritin levels. And most women are also not taught when you are going to be doing tests, like what are we looking for? What are the normal levels? What are the optimum levels? Normally, women just know that I need to go do the test, and that's that. Because I love stories, I'll share another story. How am I doing? Okay, I'm just waiting for you. I've got a high school friend. She was on the loop, so her periods were never really a thing. And then she started struggling with mood swings, irritability, depression. And then she went for a consultation because of the expected age. Then the doctor put her on antidepressants. And then life went on. And then in 2023, when we were talking about menopause and everything, she had her own aha moment. And she went back for a consultation because every year she will do total, like full body, like tests and everything. She asked to check from as far back as 2015 what has been happening with all her results. And then when she was looking at her FSH levels, LH levels, and all of that from 2017, they were already showing that she was actually transitioning. But because she was not expected to be at that age, it was missed. Because she was not having hot flashes, it was missed. Which is another thing that it is important for patients to have that relationship where they can actually have a moment to be shown this is what we look for, so that if something is missed, then they are able to actually pull it up. I know that I'm actually almost out of time. So what I'm going to do, I'm just going to read an open letter from my book. I've got different open letters, but the one that I'm going to share, it is to doctors. Am I allowed to do that? Would you like to hear the open letter? Yeah? Am I sending you guys to sleep? Yeah? You're absorbing. You know, it's so difficult to speak this subject because, like, the room just goes so silent sometimes, you know? Anyway, dear doctors, quite a number of women have expressed that their symptoms are not given the agency and attention that they deserve, especially younger women. They feel unheard. My experience was completely different. Both the GP and the gynae were exceptional. That is why this book is dedicated to my gynae, the late Dr. Kakula, just in case someone knows him. He was based in Eguruleni. He walked the journey with me. I was on the brink of suicide, and he's the one that pulled me up, taught me so much, because we know that sometimes medical consultations can feel like they are rushed. So actually, taking that extra minute with your patient, it makes a world of a difference. And some women also are complaining that most doctors now are influencers. They feel like they're so quick to want to get them out of the consultation room so that they can record their TikTok videos and all of these things. Oh, I see someone that is saying. Okay, if that's the case, noted. This, however, does not nullify other women's experience. It got interesting when I came across an article from Knowledgeable magazine in 2022 titled When Depression Sneaks Up on Menopause. It mentioned that, and medical education often skips over menopause, producing doctors who don't know how to recognize menopause transition. If you fall into this category, please do take it upon yourself to equip yourself, or be able to have like a network of doctors that you can refer your patient to. So the exceptional medical experts, thank you so much. You play a crucial role that is highly appreciated.
Xoli, thank you. It's always interesting to hear from the patients. Let's give her a round of applause.
They feel like I don't deserve it. Yeah, to like ask
No,
for it.
no. You're still gonna do some work because I stopped you a little bit early because we're really enjoying the conversation part of how we're presenting some of the topics at GP Expo this year. So, right, who's got questions? Now, I want at least one question from a guy. Okay, how many of you here are GPs? Don't be shy. I'm not going to pick on you. I'm not that guy. Okay, cool. We are 4 podiatrists in the audience. Okay, podiatrists are foot doctors. Yeah. Okay. And I was very surprised to hear the lower limb symptoms. You talked about some nail changes, burning feet, and heel pain. Are there any others or weird things that are quite specific to menopause in the lower limb?
No, plantar fascias. That's that. As we spoke also about the cold flashes, like women then get like cold feet again. So, and then what else that I'm trying to think of? Yeah.
I suppose
mostly
the symptoms
those.
are quite broad. Was there anything on that very long list that any of you were surprised by? I know it's all very individual and it can come in huge combinations of a very long list. But do you find that there were some things on that list of, oh, maybe that patient I need to go and think of again or do some other tests? Are you guys thinking of any of your patients or things like that? Okay. Ladies, are any of you in this sort of phase of life or wondering if it's happening early or not happening at all? Always happening for him. Hema, breathe through it.
Yes. And the reality is menopause is happening earlier and earlier due to lifestyle changes, the EDCs that we are exposed to, all these chemicals, whether through our hair care products, self-care products,
That's a very underexposed conversation. Hormonal changes in cosmetics and otherwise products. I've got a very strong nod of a head over here. And I think as doctors, we don't know very much about that. Correct me if I'm wrong. We don't really realize how much stuff in products affects how our hormones function. It's quite a hot topic in the cosmetics industry at the moment, just for your information. Yes, a question from a gentleman.
Thank you so much for sharing all that information. She asked, what can we do as guys? So I suppose maybe it's a question maybe you can ask your spouse. What is it that you can do to help or to ease some of those symptoms? Because we are in the dark. So if you can just
Thank you so much for
guide us.
acknowledging that and for speaking for quite a number of men that might not have been like, I'll raise my hand to find out. As we said, that everybody's experience is different and it is valid. So the first basis is to have the conversation with the partner. How best may I support you? And also take time to read up for yourself, because sometimes it's the man that notices the changes before the partner, because sometimes when you are in a thing, you are so immersed in it, you cannot see. So know as much as possible. And also the reassurance, also because, according to the Dahlia study that was done here in South Africa, 2 out of 5 women will hide their menopause struggles at home, because our value and worth is deemed in our ability to stay young, be youthful, be so many other things. So that assurance plays a huge role. And also check also how they embrace this phase of life, because humor also does play a huge role. So if then she is open to that, then you can do that. And reading up also as much as possible. In this book, chapter 25, it's got an experience of men from the UK that spoke about it, because it's important to save so many marriages and also family dynamics. And also to touch on that, also as women are getting older, men also as they get older, their testosterone levels also start declining. And it presents with its own changes also. So that's when you find more couples also having the strife. And you add also sometimes having teenagers that are also in puberty. Then you find that the whole household, it is in tatters. People are not getting along because everybody's dealing with their own hormonal effects.
Xoli, I read in your biography that you're involved in some capacity with the University of the Free State. How are you involved there?
It's in this capacity again because, as I say, menopause is a hardly spoken about subject that is hardly touched on. So there are human sciences and other interested departments. We sit and engage on this subject.
So are you actually helping them formulate and guide research?
Not specifically with them. The ones that I've done is with some ladies from UNISA.
Okay.
Yes, but
okay.
with UFS, we do not have a specific research that we are doing.
Do
No.
any of you know if there's any academic menopause research happening anywhere? Or
Yes, sir, the hand went up. Yes, love it.
Actually, a lot of it. So, so there's quite a lot of research which is going on menopause and the peri and postmenopausal period. So, in order to get a lot of more information, because there's a lot of studies and data in books actually. The best society to that deals with it is the South African Menopause Society. They've got quite a lot of information. They've got a lot of symposiums as well, conferences. In fact, I think there is one that's going to be coming up in May. I think it's in the Free State, if it's not in Stellenbosch. So yes, and most universities are doing that. It's just that it's more the gynae departments, VITS, UCT, Stellenbosch, Pretoria. They are quite big on that. Yeah, thank you.
thank you for sharing that with us. It's good to know where the resources are, and I didn't know there wasn't a society. So
No,
that's really good to know.
And
Okay.
also the fact that October is World Menopause Awareness Month, but it's not even in our Department of Health calendar. 18th of October is World Menopause Day, and they have themes every year, and it's been the case, but yeah.
Well, Xoli, thank you very much for sharing your time with us.
I'd like to connect with you, please.
He's going to run away, that's fine. Okay, so thank you very much for spending time with us. Do you have any of your books with you today?
Yeah, I do have a
You
few.
do have a few?
Yeah.
Xoli's going to hang around for a little bit, somewhere down here. So if you want to connect with her or read the blurb of her book, please connect with her. A small token of our appreciation.
Thank you.
Thank you. And
Thank
I'm sure
you.
we'll see you around
Thank
again.
you.